Sure. So I'm one of the specialist pharmacists for medicine in the organisation, and I'm currently working on a work stream looking at streamlining the discharge process in the organisation. And the idea is to prepare discharge summaries and discharge medicines 24 hours before a patient is discharged. And the idea behind that is to facilitate more patient discharge earlier in the day, and thereby improve patient flow and increase bed capacity in the organisation. This was something that was raised at some of the post-op excellence working groups post the first wave of the COVID pandemic and our response to it. And various groups of people raised how the TTA process could be, the discharge process could be improved, or what some of the obstacles and challenges are, particularly at a time where turnover through the hospital was probably a lot higher than it has been ordinarily. And that was what led to the formation of a TTA working group, and I was very keen to get involved with that and look at ways that we could move that forward. Yeah, so discharge in itself is a multifactorial process. It involves people, technology, services, patients. So coordinating all those things together is a task in itself. But the real challenge for us was understanding what the problems were with the current process. There were lots of anecdotal reports of things perhaps that weren't at its optimal, or things that could be improved. And I think clinical staff are really good at sort of getting to solutions to problems which, when they perhaps don't understand what the underlying problem is in itself. And this is where we use QI quite a lot, and the improvement team really helped us with unpicking this complex problem and using a sort of streamlined way to work through those and get to the outcome which we wanted, which was to have more proactive discharge. Yeah, so the team have been fantastic in helping us, and they're really good at sort of helping us understand that problem. So we spent a lot of time at the beginning of the project really drilling down to the root cause of the issues with TTA, and we used a fishbone analysis to do that. And after doing that fishbone analysis and consulting with all the various stakeholders that were involved, we then listed all our actions, and we used a prioritization matrix which looked at the feasibility and the sort of difficulty with doing each of those actions. And then very lastly, we used something called a Pareto diagram, which helped us with impact analysis and really help us to prioritize on the actions that are going to have the biggest impact on reaching the outcome that we wanted to. And I'm sure we've used lots of others, but those are the three main ones that really stick with me. It's been great. I've never had an experience like this before, and often when you're not particularly senior in the organisation, you can feel like you can't make a big enough change, and the improvement team have been really good at helping us unpick this very complex and adaptive problem that we've got with discharges. And so yes, as I mentioned before, we've spent lots of time on root cause analysis and very clearly defining the problem. They've also been key at bringing all the relevant stakeholders together and providing a platform for everyone to have a voice and for everyone to be able to discuss the problem, and more importantly, what the solutions to those problems are. And they've also been very good at helping us to remove some of the roadblocks and also flattening the hierarchy in the organisation. What I mean by that is we've had access to some really important decision makers in the organisation, which ordinarily, without them, perhaps we wouldn't have had.